Okay, 2:30 is upon us. I think we will go ahead and get started. Thank you for joining us for our media briefing today about COVID-19 vaccine in Idaho. My name is Nicole Foy, and I am moderating the briefing today. ASL interpretation is available. If you search for the window for interpreter stubs and hover over the three little dots to the right in the video window, you can lock that screen in place. So for the briefing today, I'm pleased to say that Governor Little is going to start us off. He will offer some remarks for a few minutes, and then he'll have to leave the briefing. We'll also be hearing from Health and Welfare Director Dave Jepson and Public Health Administrator Elke Shaw-Tulloch before we open it up for vaccine-related questions from the media. Our state epidemiologist, Dr. Christine Hahn, and Idaho Immunization Program Manager, Sarah Leeds, also are going to be participating today, and we will not be taking questions from the public. Please note that everyone should be muted unless they are speaking, and with that, I will turn it over to Governor Little.
All right, can you hear me, Nikki?
Yes, we can hear you just fine, Governor.
Good, thank you. Well, Saturday, seems like it's been longer than a year to me, marks the 1 year since the first case of COVID-19 in Idaho. Tragically, we've lost close to 1,900 of our fellow Idahoans to this new, dangerous, and aggressive disease. We mourn the loss of life and pray for strength and peace for the loved ones they've left behind. Our over 173,000 Idahoans have been infected, and some will have to deal with long-standing health effects from COVID-19 for we don't know how long. But now, more than 284,000 Idahoans have received at least their first dose of a safe and effective COVID-19 vaccine. We've turned the corner in our pandemic fight, and I believe the worst part is behind us. That said, we must remain vigilant. We have a way to go before we can return to life as normal. I want to thank the people of Idaho from the bottom of my heart for the sacrifices they have made over the past year, but I specifically want to thank the entire public health team, from frontline nurses to my state health team, for the incredible work they've done over the last year. You stepped up in new ways to protect lives, be there for your children, and help our entire state move together. And together, we've made an incredible amount of progress. For example, we are a leading state for the share of vaccine doses administered. Our positivity rate has finally met our goal of being under 5%. We prevented a crisis in our hospitals, and case counts, hospitalizations continue to climb, while our economy, schools, and churches have stayed open. We've distributed most of our federal relief funds in direct support to citizens and businesses through tax relief and grants. We've achieved all of that together. And now, because of our collective good works, we have the strongest economy in the nation. There's a direct and positive correlation between public health and economic prosperity and having our kids in schools. We have the most financially solvent state budget with a record budget surplus, and we're poised to provide Idahoans with historic tax relief and make strategic investments in transportation, education, water, broadband, and other critical areas through our Building Idaho's Future plan. We have the lowest unemployment, or the highest employment, and we saw the biggest increase in personal income growth. We saw the biggest increase in small business formation over the last year. As we reflect on the momentous past 12 months, let's remember that we cannot maintain all our progress unless we continue to take steps to protect lives. Idaho and our precious public health team, thank you very much. Thank you for your perseverance and your sacrifice. We will continue together to be stronger. With that, Nikki, I'll turn it over to Dave to kick things off. Thanks, Nikki.
Thanks, Governor.
Yeah, thank you, Governor. We appreciate you being here today. I have just a few comments, and then I'll hand it over to Elke here. We just also note that we've been 1 year since our first case, and it's been a long and tough year, but we've made lots of progress, as the governor highlighted. We started publishing race and ethnicity data for those who have been vaccinated about a week ago. There was a question last week about whether that data was historical back to December, when the first COVID-19 vaccines were given. And the answer to that question is yes. The published data is all the race and ethnicity data that enrolled COVID-19 vaccine providers have provided since December. As a reminder, patients are not required to provide race and ethnicity information, but a vaccine provider is required to send it to us if the patient has provided, if the patient has elected to provide it. A quick update on the statewide vaccine pre-registration solution that went live on Friday, March 5th. About 45,000 Idahoans have registered since Friday. The main objective of this solution is to give Idahoans one place to go to register that they are interested in getting vaccinated. Once registered, an enrolled COVID-19 vaccine provider will reach out to schedule an appointment when they are eligible to get vaccinated and when the provider has appointments open. This will eliminate the need to check websites or make phone calls multiple times a day. This is a brand new tool and it is working well, but we have also received some excellent feedback on ways that we can make the tool even better. Now that the tool is live, we will continue to improve the pre-registration tool based on the feedback we receive. I'm happy to report that about 55% of those 65 and older have had at least one shot. However, we are noticing that despite a large number of seniors who have not yet been vaccinated, it appears that demand has started to decline a bit. And our supply of Moderna and Pfizer first doses has increased to over 45,000 per week. Let me say that again, we're about 45,000 first doses of Moderna and Pfizer. I do want to say that does not include the new Johnson & Johnson vaccine, and as that becomes a steady supply, that number will continue to rise. However, this has resulted in some vaccine providers struggling to fill their available appointments. As a result, most of the 7 public health districts have already, or will this week, open up Group 2.3 ahead of the previously announced March 15th date. In addition, Group 2.3 is employer-based, which is a different set of logistics between health districts, employers, vaccine providers, and individuals than we had in the 65 and older group. As we work through Group 2.3 over the next week or two, some vaccine providers could find themselves in a situation where they have open appointments that they are struggling to fill. We will release guidance here shortly, this week, and probably in the next day or two, for vaccine providers who find themselves in this situation. Finally, just a reminder to please physically distance, wear a mask, and keep your hands clean as we continue to the great progress that the governor highlighted. And with that, I'll hand it over to Elke.
Great, thank you very much, Director. I appreciate it. So today, I wanted to thank you all for participating in today's press briefing, and I have 3 items that I'll be going over with you today. I'm going to talk about our COVID-19 Vaccine Advisory Committee, the Federal Retail Pharmacy Program, and also the new CDC recommendations for people who are fully vaccinated. So just as a refresher, the COVID-19 Vaccine Advisory Committee, or CVAC, provides recommendations to the department and to the governor on prioritizations of prioritizations of populations to vaccinate when vaccine supply is limited. And I want to take this opportunity as well to thank all of our CVAC members. They are all volunteers, and we have both voting and non-voting or ex officio members, and they've all worked very, very hard over the last several months helping us work on priority populations, and we really, truly, truly appreciate all the work that they've been doing. So at our last meeting, which was on Friday, March 5th, the CVAC meeting committee met and confirmed 1 negative vote on a clarification for Group 2 and undertook extensive conversation and voting on Group 3. So these recommendations were brought to the governor yesterday, and he accepted those recommendations. So this means that FAA, Airway Transportation Systems Specialists, will not be included in Group 2. That was a specific request that was made. And Group 3 will be an age-based approach with an emphasis on people with medical conditions per the Centers for Disease Control and Prevention, as well as people with disabilities. As a reminder, Group 2 includes people aged 65 and over, frontline essential workers, as well as homeless shelter residents. This is the group that we are currently vaccinating now. Under consideration for Group 3, when CVAC met on Friday, were people aged 16 to 64 with medical conditions putting them at risk for severe COVID-19 illness, as well as the remaining essential workers not considered frontline. So as a result of these conversations and working with the governor's office, no later than March 15th, people aged 55 to 64 will be eligible for vaccine for 2 weeks. The first week will be focused on people with medical conditions, and the second week will be the remainder of the age group. Then, no later than March 29th, people aged 45 to 54 will be eligible for vaccine for 2 weeks. Again, the first week will be focused on people with medical conditions, and the second week will be the remainder of the age group. You can find this information already out on the coronavirus.idaho.gov site under the vaccine tab. CVAC will also reconvene to discuss and recommend to the governor the population groups to follow those people who are aged 45 to 54. They have options to consider. Some of those options may include people aged 16 to 45 with medical conditions, followed by the remainder of the population, or continuing with the cadence of age groups where 1 week is for people with medical conditions in that age span, and the next week is for the general population in that age span. CVAC will also be taking up congregate settings as in their deliberations, and they'll take a vote on, and they'll have to reconsider their deliberations because their vote on March 5th, or last Friday, was short on time. So on March 19th, CVAC will define congregate settings and vote to determine if people who live in congregate settings will be prioritized in Group 3, or if they will not be prioritized like the essential workers and will just have them fall into the age categorization. So the next 2 meetings of CVAC will be on March 12th from 12 to 1, which is this Friday, and the following Friday, March 19th from 12 to 2. So moving on, we'll give you some information on the the federal retail pharmacy program. And since my last update on the federal retail pharmacy program, this past week, Walgreens was activated to participate in the program. With the addition of Walgreens, we now have 4 separate pharmacy organizations within the partnership. So we now have Albertsons, Walmart, Cardinal Pharmacies, and Walgreens at 134 locations across the state. Walgreens, as you recall, has been receiving vaccine through the long-term care facility federal program since December of 2020, and now they'll be participating in the retail pharmacy program. And as of this week, Idaho's federal retail pharmacy program has allocated to date 50,830 first doses to this partnership. 24,500 were Moderna, 22,230 were Pfizer, and 4,100 of the Johnson & Johnson vaccine. We're anticipating that this program will continue to bring over 10,000 first doses in addition to the state's allocation of first doses. And as a reminder, all those doses that are administered through this federal partnership are being tracked on Idaho's COVID-19 Vaccine Administration Transparency Dashboard, data dashboard. And finally, I want to talk about the new CDC guidance for fully vaccinated people. And it's been all over the news in the last day or so because yesterday CDC released their interim public health recommendations for fully vaccinated people. A person is considered fully vaccinated 2 weeks after a single dose of the Janssen vaccine or after the second dose of either the Pfizer or the Moderna vaccine. They released their interim recommendations as well as background material, their background rationale for their recommendations. And in short, it says that if you're fully vaccinated, you can gather indoors with fully vaccinated people without wearing a mask. You can gather indoors with unvaccinated people from one other household. So for example, if you're visiting relatives who all live together, and you can do that without wearing masks, unless any of those people or anyone they live with has an increased risk for severe COVID-19 illness. You can also, if you've been fully vaccinated, And if you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. However, if you live in a group setting, like in a correctional detention facility or group home, and are around someone who has COVID-19, you should stay, stay away from others for 14 days and get tested, even if you don't have symptoms. However, CDC does state in their new recommendations that you still must take steps to protect yourself and others, such as wearing a mask and staying 6 feet apart in public, when gathering with unvaccinated people from more than one other household, and when visiting with an unvaccinated person who has an increased risk. You should still avoid medium or large size gatherings. You should still delay domestic and international travel. And of course, you should still watch for any symptoms of COVID-19, especially if you've been around someone who is sick. And of course, get tested and stay home if you have symptoms. And lastly, they recommend to follow the guidance at your workplace regarding your COVID protocols. So we will be working with our communications team to get more messages out there and make them more readily available to the public. I think is a fantastic incentive, along with all the other benefits of getting a vaccine, to have these recommendations out there now available. So to end, excuse me, I do want to take a moment just to reiterate the governor's comments earlier and recognize the significance of this anniversary of our first case in Idaho. I think it's really important to recognize the thousands of Idahoans who have become seriously ill, who have died due to COVID during this last year, and the toll that it's taken. It's also important to acknowledge that we've made some significant strides and we have many successes and we have our promising case rates and hospitalization rates. With these great strides, there comes great hope and great joy, but we also need to make sure that we are all staying very, as the governor said, very vigilant. We're not out of the woods yet, and we need to continue to remain alert. And we need to take all of those precautionary measures, as the director just said as well, until more Idahoans can get the vaccine. We're so close, but we need to keep up our good work and keep ourselves healthy and those around us healthy. With that, Nikki, I'll turn it back to you.
All right, thanks, Elke, and thanks, Director Jepson. So we will now take vaccine-related questions from the media. We're going to answer as many questions as we can in the time we have available today. If you do have a question, please raise your hand in WebEx by selecting the hand icon in the lower right portion of your screen. You can also type your question into the chat area, which you can access also in the lower right part of your screen. When I say your name, please unmute yourself and announce your name and media outlet before asking your question. And please remember to clear your hand when you're done. So it looks like we have Audrey Dutton has her hand up. We'll start with her.
Hi, this is Audrey Dutton from the Idaho Statesman. Speeding up the rollout is good if the goal is to get doses in arms as quickly as possible. And I am certain a lot of the people that I've been talking with lately are going to be very excited about this. But the problem seems to be, the reason we're having this issue seems to be vaccine hesitancy and or access to vaccinators and access to vaccines, awareness that people are eligible, things like that. So speeding up the rollout doesn't really address that underlying issue. So how is the state working to make sure vaccines reach Idahoans who aren't already motivated, mobile, and have the ability to drop what they're doing, go get extra doses if that's the case, and generally can take off work to get doses, things like that? How is the state working on those issues?
Thank you, Audrey. Those are the great comments and questions in there. Excuse me. I keep having a coughing fit today. So we are absolutely working with all of our partners across the state to make sure that we're addressing exactly the issues that you raised. We want to make sure that we have flexibility across the state. We know that every region of the state has different belief systems about the vaccine. They have different needs in terms of how they can get to the vaccine or how the vaccine needs to be brought to them. I think we've talked about this in past press briefings as well. We need to do our part as vaccine providers to make sure we meet people where they are. So we have flexible vaccine clinics that they can occur on the weekends. So we are working very closely with our local public health districts, and in turn with our providers. We're providing education to them. We're talking a lot about equity and making sure that there's fairness in the way that the vaccine is being distributed and administered. So we've worked with the partners as well as CVAC, of course, on coming up with some of these recommendations and really listening to some of the issues across the state as well. We want to make sure that there's maximum flexibility. So if, we don't want any vaccine doses to be wasted, of course, but we also want to make sure that if there's the need to be flexible in communities, that they have that ultimate flexibility. Of course, always being mindful of those that are most significantly at risk of COVID and making sure we reach those priority populations first. So that's a really long-winded answer to say that we definitely hear you, and we are taking all of those things very much into consideration and realizing, as we've talked about a lot, it's not, none of this is going to be smooth sailing, but we're trying to do our best to make sure that it's as smooth as possible and reaches everybody as effectively as possible. With that, I'll turn it over and see if Director Jepson has any additional comments.
Okay, I think you did an excellent job of covering that. I don't have anything to add to that.
Could you, just one quick follow-up, could you give us an example of something that you're working on that can help people understand they're eligible and that the vaccine is safe and its efficacy has been tested and it's our only way out of the pandemic? Just one example of how you're helping people understand that.
Yeah, thank you. I can give you a very concrete example of something that just came up in a conversation last night, and learned that Idaho State University actually is doing, I don't know if I want to call it a study, I don't know if that's how they classified it, but they are doing some work on hiring some community health workers or working with community health workers to really understand, for example, vaccine hesitancy issues with the Hispanic population, and doing some interviews. And so one of the things that they have found is maybe some of the hesitancy may be related to beliefs that the vaccine may cause infertility, or some other just common myths about the vaccine. And I didn't hear the entire presentation from them, but just heard that this work was going on. So certainly we use all the information about populations to understand maybe what some of the issues are around vaccine hesitancy, so we can help build our communications work, and as well as at the local level. So the local public health communications folks can also reach out to those priority populations. I also want to add that, we work very closely with members of our CVAC committee. We have a very broad representation on that committee, as well as many other partners in public health and in healthcare, that we really also want to make sure that we tap into and have that kind of collective message, and keep pushing those messages out there so people do understand any issues related with the vaccine that they may have, and how we can address those, and making sure that we're doing the best we can to get those messages out in the right, appropriate, and culturally sensitive way.
And okay, if I could just add to that, we are planning to run essentially a public service announcement type of campaign, specifically targeted to those that may be hesitant or concerned about the vaccine. That's going to be based on research we've done with what those concerns are, and we expect that campaign to start in the very first part of April. So keep an eye out for that. The other thing we know is that for those that the vast majority of the reason people are hesitant is really around is it safe and what are the side effects, and primarily they want to hear that the answers to that from us, which is it is safe, it's been thoroughly tested, and there are side effects, but they're relatively minor, but they want to hear that from their medical professionals. And so we continue to work with the vaccine providers and physicians and physician assistants and others to make sure they have the information they need to actually talk with patients about their concerns and help them understand what that means for their situation. So lots in the works here to really help Idahoans understand what the vaccines is and what the benefits are to them, and that it is safe and it is effective, and we'll continue to do that going forward.
Okay, our next question is going to come from Joe Parris.
Thank you. I guess this question goes to whoever can answer it best. With that CDC guidance that was referenced a few minutes ago on fully vaccinated people not having to wear masks with each other, we started getting a lot of questions about the hypothetical vaccine passport and questions about people who decide to not get the vaccine or can't get the vaccine. Moving forward in Idaho specifically, do you think there will be guidance that will apply to one group of people who has vaccines and then guidance to people that don't? I know there is concern that in communities, or communities is the wrong word, but amongst groups of people that are not vaccinated, there's a concern that the virus could stay alive and continue to spread.
Yeah. Thank you, Joe, for the question. And I'm actually going to turn this over to Dr. Hahn because she's been staying very up to speed on some of these issues.
Yeah, thank you, Elke. That's a really good question. It's you bring up a really, obviously, really important point, and this is being discussed. You may have heard that in Europe, at least until recently, they were discussing immunity passports and people that can document that they've had vaccine being able to travel freely, for example. And as I'm sure you saw in the CDC guidelines that were released yesterday, that CDC is still saying that even if you've been vaccinated, you should still be deferring your, trip to Disneyland or your vacation plans because of all the concerns that you guys are well aware of ongoing concern about transmission and travel, bringing variants around the country. So what I would say is I think we would very much in Idaho want to follow a national leadership on this. Of course, we always put an Idaho spin on it if we don't quite agree or if we have our own way, would rather go. But because of all the issues involving travel and people, how they're impacted, I think we want to watch for that national conversation. For right now, we certainly support the guidelines that Elke just reviewed with you. I think they give people a sense of, okay, now that I'm vaccinated, I can go visit my mom or I can go do some things. It gives you that feeling of being able to breathe again and feeling a little more free, but still reminds us all about the precautions.
And I guess more specifically, I should have clarified this. When making recommendations to the governor's office in terms of health orders, would there be a situation where you would say, people who have been fully vaccinated are welcome to dine in restaurants without masks and we're not going to worry about it as much? Whereas if you haven't been vaccinated, we still ask that you wear a mask out in public.
Yeah, Joe, that's obviously one of those hypothetical future, we don't know what the future looks like kind of questions. I think that's something that we have not even we certainly never discussed that, and I think that would be a very, very difficult way to go. None of us want to envision us having to carry around some sort of a card or proof of vaccination before we can enter a restaurant, that kind of thing. So I don't foresee that. Obviously, we can't predict the future, but I have a hard time seeing how that could possibly work, or that we would want to live in that type of a society unless it really came down to no other choice. I don't know if
Awesome,
your director has more to add on that, but that'd be my feeling. Sorry.
Thanks, Chris. I don't have anything else to add.
Okay, we'll go on to our next question, which is going to come from Rebecca Boone.
Hi, thanks for taking my question. This is Rebecca Boone from the Associated Press. I'm wondering, given that we have, I think about 43% or so of the, I'm guessing, of the people who are probably mostly in group 1 and group 2 vaccinated at this point, just based on the numbers of people estimated in those groups and the number of people who have had at least 1 dose so far. Does that give us any information on what we can expect as far as the possibility of reaching herd immunity in Idaho? And I'm also wondering what Idaho's large juvenile population, how that might impact our ability or the time in which we can reach herd immunity.
Thank you, Rebecca. I know Dr. Hahn has been in many conversations around what herd immunity means, and so I'll let her take that. But well, I'll just let her take the whole question, then we don't have to break it up for you.
Yeah, thank you. We certainly, as Elke mentioned, we've certainly think about this a lot, and we continue to just follow the science. Right now, we are still hearing 80 to 85% of population immunized. I even heard Dr. Walensky in the last week say 90%, which made my heart drop because it's obviously the higher it goes, the more of a challenge it will be to get there. So we will continue to keep it. That's obviously the end game. It's a ways away. And I think as to some of the earlier questions about what are we doing to reach out to populations that are more hesitant, it just shows us the work we need to do. We really need to work on trying to educate people, hopefully some people, as time goes on and they see their friends and their neighbors and maybe leaders in their community get vaccinated and not have any problems. We're hoping that vaccine confidence and interest in vaccination will continue to increase, but we can't predict that for sure. It's a very challenging question, and I'm sorry if there was something else that you asked that I missed.
I think that covers it. Thank you.
Okay, thanks, Rebecca.
Okay, our next question is going to come from Hayat Noormini.
Hi, thank you. I had a bit of a follow-up to the vaccine hesitancy issue. Do you have a general sense of geographic areas that are more hesitant to take the vaccine or have more unfilled appointments? And to follow up on that, I'm wondering if there's ever been, a discussion with state legislators around talking to their constituents about encouraging them to take the vaccine.
I'll start in on that question. And most certainly we have at least from a pediatric vaccine standpoint, we have pretty good data on where across the state there are areas that are more vaccine hesitant or vaccine adverse than others. We're also seeing some of that rolling out, of course, with the adult vaccine, with the adult COVID vaccine, as we've been working our way through the different priority groups that we have right now. And so that's why we want to make sure that we have that flexibility. So as some of the health districts and the providers start kind of running into those areas where it's a little bit more challenging to fill some of those positions we have readily available, that next group, we still have a huge demand for the vaccine across the entire state. We know that there's not a single part of the state that's, hands down has said no way, no how. We still see it across the entire state, people coming out and wanting to get the vaccine. So we are doing things to try to address that vaccine hesitancy, as we talked about. And now I'm just forgetting the latter part of your question. I'm sorry, if you could repeat it.
Yeah, I'm wondering if there's been any discussion of having a relationship with, state legislators, especially in areas.
Sorry, yes, legislators.
Yeah.
My apologies. I do know that some legislators are, requesting that we give some presentations at their town hall. I know that I've done a couple of them myself. Certainly, we've had conversations with the legislature. I know the director, you've had many conversations and given some presentations. So I think there are, for those that want to engage in those conversations, we certainly have done so. And Director, I'll turn it over to you to see if there's anything more specific that you've been engaged in.
I don't have too much to add to that, Elke, but yes, we have had conversations with many legislators about the vaccine rollout across the state, and it's really at their discretion, but several have asked us to help them with communicating in their constituencies. As Elke mentioned, she's joined a couple of those. And then I've made a presentation to the Health and Welfare Committee specifically about the vaccination effort, and left that offer open if there's anything we can do to help them with their constituents to please reach out. And so I do think that there's been that invitation out there, and certainly some legislators are reaching out to take advantage of that and to get the message out to their constituents.
Okay, our next question comes from Kyle Pfannenstiel.
Thanks. This is Kyle Pfannenstiel with the Post Register. I'm not sure who this question would go to next, but when you approach questions about vaccine hesitancy, I've heard it characterized in kind of three groups of people: people who want to get it now, people who will wait and see how the vaccine plays out in their neighbors and their family members, and people who are never willing to get the vaccine. I'm wondering where the state health department, how large are these different groups?
Director, were you starting to answer that?
I was just going to ask if you want me to take that or if you wanted that.
Yeah, no, go ahead.
Okay, great. So Kyle, that's a great question. We've actually done some polling with citizens of Idaho across the state, and the results of that indicate that there's, and these are rough numbers, but there's roughly 60% of Idahoans who are anxiously awaiting, if not already vaccinated, anxiously waiting to get vaccinated. And this is of the adult population. Obviously, we don't have a vaccine approved for children yet, so I'm speaking just of adults. So about 60% of that population is ready to get vaccinated as soon as possible. And then the numbers get a little bit squishier, but somewhere around 20% of the population are in what we would call the interested. They're not opposed to the vaccine, but they're in kind of the, I'm going to wait and see. I want to wait and see how my family does. I want to wait and see how this rolls out. I want to wait and see if the other people I know have side effects. But there's kind of that 20% kind of in that wait and see category. And again, they're not opposed to the vaccine. They have a belief, at least based on the survey data we've looked at, they have a belief that vaccines work and are effective. And but it's more of that kind of wait and see. And most of those concerns revolve around safety and side effects. So they're going to kind of wait and see. And that leaves about 20% of the population that has some portion that's in the I'm never ever going to take the vaccine, or some portion that's going to be much harder to convince to take the vaccine. And so that's the numbers that we've seen in our survey work we've done, is about 60%, 20%, and 20%.
Do you have any understanding of when folks will have waited and seen enough?
Yeah, I mean, obviously this is based on survey data, so we haven't gone out to ask every Idahoan. But it looks like, so if we talk about that wait and see group, which is about 20% roughly of the state, it looks like a good chunk of them are kind of in that 6 months or so. And by the time you get to wait a year, you get through, I would call it a majority of that group that's waiting to see. There's very few that are saying, I need to wait 2 years to wait and see. It tends to kind of run in that 6 months to a year kind of. From their perspective, that gives them time to see people they know get vaccinated, time to see if there's any side effects that they might not like or that might come out later, and give them the confidence to move forward. And so, again, that's based on survey data, but it tends to be in that 6 month to a year range.
Okay. Our next director, did you have something else? It looked like possibly you, nope, okay. Our next question comes from Nicole Foy.
Yeah, hi, I'm Nicole Foy from the Idaho Statesman. Going back to this equity question, and I understand that there have already started to be some limited efforts to get the vaccine specifically to groups like Spanish-speaking seniors, or farm workers is in the plan as that eligibility opens up. I'm hearing of very small doses allotted for this. So, for example, the Mexican consulate's clinic today for seniors had like 50 doses. I just available. Another one coming up for farm workers in 2 weeks has about like 150 doses allotted so far. Those are really small doses. And so I'm just wondering what, as we're talking about making sure that there's going to be, this vaccine is going to be distributed equitably. And of course, many other clinics have much larger doses available. I'm curious what's driving this. Are they test balloons to see how they work, how much interest is from the community? And if there's worried about lack of interest, what's being done to mitigate that at a statewide level?
Yeah, I can, again, to kind of give you some more specific examples. When we were talking with our local public health districts, just yesterday, as a matter of fact, there were conversations around some of the work that they've done to establish, for example, a Spanish-speaking only clinic. And working for several weeks to recruit to recruit individuals to come in and participate in that vaccine clinic. They put information out in Spanish. They used community members to help recruit people to come in and fill those spots. They made sure they had Spanish translated materials on their websites. They, again, try to do that, word of mouth recruitment and many other tactics. And so they opened up and had a very low turnout in some of the areas. So I think it might be that you're seeing some of that is just testing it for now and deciding if that's the best mechanism, or if it's we need to do something wholly different and move to another area. So I think as we continue to move through different age groups, for example, and different occupations right now in group 2.3 that's being vaccinated, I think you'll see a wider variety of mechanisms to get the vaccine out.
Okay, our next question comes from Melissa Davlin.
Thank you, Nikki. I'm not sure if this question is for the director or Elke or Sarah, but piggybacking onto this conversation about vaccine hesitancy, are you hearing from providers that Catholics in the state are concerned about getting the Johnson & Johnson vaccine, or asking for the Moderna or Pfizer vaccine after last week's statement from the U.S. Conference of Catholic Bishops?
Yeah, and I know Sarah has had some very direct conversations with some of the providers as well. So I'll maybe let Sarah go first, and then Director, if you have anything you want to add after that.
Yeah, thanks, Elke. I have not specifically heard that from providers as yet. We got 13,300 doses last week, and as predicted, we have not gotten additional allocations. So we have not heard that yet, and I think that perhaps that's a very limited supply of doses, but maybe we'll hear something different as we get more and more doses. But at this point, there were a lot of folks who wanted that and were administering it. So.
Oh, sorry, go ahead, Elke.
Oh, I was just going to see if the director had anything to add. I know that I haven't heard anything myself. If anything, only heard the opposite, that people want that vaccine, but Director, go ahead.
I think you and Sarah covered everything that I know about that at this point.
And conversely, along those lines, are you hearing that people are preferring the Moderna and Pfizer vaccine over Johnson & Johnson because of the efficacy?
Yeah, anecdotally, we have heard that people have said that they would prefer the Janssen vaccine, and as they were looking at making an appointment, they've said that we would just wait until they could get that vaccine. That's all anecdotal to date. We don't have a lot of data to support that and information at this time.
Thank you.
Mm-hmm.
Okay, looks like I have a question. I'm sorry, I'm catching up to the chat here. Do we have any estimates how many Idahoans have gotten the virus who weren't able to be tested in the early going? You know what, Karen, that's a question. We'll get back to you on that since it's not actually vaccine related. And I think the other question in the chat has already been answered. So it looks like Nicole Foy might have another question. Her hand is still up.
Oh, that was my mistake. Sorry.
Oh, sorry. Okay. Joe Parris has his hand up, and he took it down.
Thank you, Nikki. Question based on President Biden's announcement last week that there was a belief that in May there would be enough vaccine dosage for all adults. And I guess a week ago during the AARP town hall, Governor Little said that he did the math and it didn't quite add up, but he said that it was possible that the state hadn't received all the updated information. And I'm curious if the state has gotten new guidance from the White House about more doses coming in, and if it looks realistic that by May there could be enough vaccine doses available for all adults in Idaho.
Thanks, Joe. I was not on the AARP call, so I'll see if the director has anything to add to that. And then certainly Sarah has daily probably communications with our federal partners on vaccine allocation.
Yeah, thank you, Joe. I think what the governor was expressing is we would need to see a pretty significant increase in the amount of doses from what we're receiving now in order to achieve making it available to any adult that wanted it by May. However, I also know that we can only see, and I'll let Sarah Leeds weigh in here, about 3 weeks into the future of what our allocation may be. And I think Sarah may be a little closer to some of our partners who may be signaling if we expect those doses to increase in the next few weeks or so. So I'll hand that over to Sarah.
Yeah, so I have a little more information, but it's of course a little, like all of us, our understanding of that is a little fuzzy, but we are seeing small increases weekly. So for example, within the past couple hours, we know that we will get a couple more trays of Pfizer vaccine for first doses. And then the Moderna is staying steady. And of course, we don't have an allocation for Janssen now. We also have had conversations with our CDC, the folks we meet with every week, to talk about challenges that we're experiencing in Idaho and any assistance we need. We specifically had that conversation on Thursday with them about the numbers don't necessarily add up for what we're getting now to then scale up that significantly, and what would need to happen for us to be able to do that. And so we are talking through how we would scale up, how we would start increasing more than 2 trays and several thousand. We're talking like doubling and tripling would need to be required on a weekly basis to be able to vaccinate every Idahoan who wants it in May. So that may happen, and we will continue to work with our federal partners to address and be able to respond. We know we have a lot of capacity with the current number of providers we have who are vaccinators, and with our pharmacy partners at the Retail Pharmacy Partnership Program level, those large chain pharmacies. And if we were to reach a capacity at that point that we would need to bring in additional help, we have those plans in place as well, and continue to hone those every week about setting up mass vaccination clinics, or at least large throughput vaccination clinics, and bringing in additional providers like the National Guard to assist. So we just continue to work on that, and like I said, like the director said, we get our numbers in 3-week increments, and they're right now just changing very in small percentages. But we're told that within a month or so that could change significantly. So I don't have anything specific, but we're hopeful.
Great, thank you so much.
Okay, we do have another question in the chat from Karen Bosick, who writes for Ion Sun Valley. She wants to know if there's going to be some way at some point that people can ask for a specific vaccine. So if they prefer Johnson & Johnson or Moderna or Pfizer or whatever, whether or not they can, they would be able to specify that when they're making their appointment.
Yeah, right now we are pushing for providers to make it known which vaccines they are giving, because that will be helpful for people who have very specific, maybe sometimes a need to get a certain vaccine over another, depending upon what their health conditions are, or what their kind of response is to other types of vaccines. So we also need to be conscientious about the fact that we want the vaccine to be out there. We want people to have it be available, and not have essentially people shopping for certain vaccines, and then that we have some that are underutilized and some that are we have a surplus, I guess, if you will. But we do want to make that known as best we can. And I know that Dr. Hahn has also been in some of those conversations about that. And I'll let you address that if you'd like.
Me?
Yes.
Okay, yeah,
Sorry.
just making sure. I wasn't sure if you were responding by the requester. Yeah, so absolutely, it's a touchy issue, you know. On the one hand, I think we all feel like it makes sense to have some ability to choose, as Elke already mentioned, if somebody had an allergic reaction or something, they need to know what they're getting. On the other hand, we don't want people to get really devoted to one particular brand that they've decided is the best and then turn down opportunities to get vaccinated. But I think all in all, in the balance of things, that for patients that it does matter, the best advice is for them to at the time they're making that appointment, or that they're offered an appointment, let's say they get a call, to ask right away what vaccine will be offered at that clinic, so there's no surprises, and that they're able to get, especially for those, of course, that can't accept any vaccine. I think it's a little bit of a shift. Some providers haven't been routinely doing that because the two vaccines were so similar.
Okay, we have another question from Hyatt.
Thank you. I'm just going to ask the same question I had asked a couple weeks ago, which was about the Janssen vaccine. Is there a strategy behind who's getting the single shot vaccines and where they're going to be distributed?
Right now, the Janssen, well, it's in such short supply right now that we distributed that initial allocation as we did the the Pfizer and the Moderna vaccine. So along the same distribution or allocations that we were doing before. So we do know, of course, that the Janssen vaccine is ideal for going into rural communities, for example, getting into those hard to reach places. It doesn't have the same storage and handling issues. So as the districts, as we start working with our local public health districts on where those vaccines will then, what providers they'll be allocated to, certainly some of those issues will be taken into consideration while they're making those decisions. Sarah, I know that you have had you have regular conversations with the local health districts, and I know that they have some ideas, and if you want to add to that, that would be great.
Yeah, I think the strategy for where that vaccine may go and to whom, what populations, is really dependent on the provider. Their strategies for tracking, not tracking, but recalling patients for that second dose versus the a single dose vaccine. So it really is happening at the local level, and we just at the immunization program level want to support their ability to administer the vaccine that they really are good at administering. And so if it's the single dose and they can really administer that to special populations or certain populations, we want to support that. And conversely, if they have a really strong recall system for people that are going to get the 2 doses, we want to support that as well and make sure that they have the inventory for the first dose, but also ensuring that the second dose comes as at the appropriate time.
Okay, I am not seeing any more raised hands from our panelists. So we'll wrap it up for today. We are planning another media briefing about COVID-19 vaccine at 2:30 p.m. Mountain Time on Tuesday, March 16th. Watch for those details on Monday, and thank you to everyone who joined us today.